Hi, I'm Anshul Katta. I'm an intern from Leadership Initiatives, and I'll just be asking you some questions and helping out with your diagnosis today. So, do you mind if I ask you a couple questions about how you're feeling today?
Hi, Anshul. How are you doing today?
I'm great. How about you?
I'm fine, thank you. So you are going to be diagnosing this patient right in front of you today. We
Mhm.
clear? Okay.
Yeah,
All right. All right. So we're good. All right.
of
So
course.
I'm going to give you some information and then I'm going to give you some information about her. And then you use that to analyze. And then if you need more information, you can ask me and I'll ask her and give you a feedback. Okay?
Okay.
All right. Good. Okay. So in front of you is a 20-year-old lady, the 20-year-old student. Her name is Halima Siraju. She presented with a 5-day history of fever, headache, and mild abdominal pain for 5 days. No diarrhea, no constipation, no cough, no difficulty in breathing. Just a fever, a headache, and mild abdominal pain for 5 days.
Okay. So the first question I'm going to ask is she part of any tribe or a religious or affiliation?
Yeah, she is a Muslim and
Hmm.
she is Hausa by tribe.
Okay, and what is her occupation and marital status as well as address?
She is a student and she is unmarried.
Hmm. Okay, so she mentioned that she has a fever. So is the fever intermittent? Does it come and go, or does it continuously ramp up all throughout the day and then
A
reset when you
fever,
go to sleep?
a fever comes and goes.
The fever comes and goes,
Yeah.
and you said it was for 5 days. So along with that, you said there's some gastrointestinal pain. So is the pain radiating? Is there anything that makes the pain worse or better at all?
Not that she reported. It just comes and it goes, resolves spontaneously.
Comes and goes spontaneously. Okay, then
Yeah.
you mentioned diarrhea as well.
No, no, no. No diarrhea. No diarrhea, no constipation. Yeah.
Mhm. Is there any dizziness at all when she gets up and sits down and moves around?
Just a little. She had that once or twice, and then she has had a decline in her appetite.
Decline in appetite. Okay. Um, along with that dizziness that I mentioned as well, is she craving substances like sand or dirt or ice?
Oh, that's very brilliant. No, she isn't craving any sand.
And along with that, to another question, is she having issues moving around? Is she having any tingling sensations in her arms?
Not that she mentioned.
Not that she mentioned.
Mhm.
Okay. Um, So my other question that I'm going to ask is there anyone else in the family who's presenting similar symptoms at all?
And no history of such.
No history of such. And are there any procedures or relevant medical experiences that have happened in the past month or years that I should know about?
No significant past history.
No significant past history. Okay. Mhm. Um, you said-
These are really brilliant questions you're asking. I'm quite
yeah,
impressed.
no. Sorry, yeah, I'm just thinking aloud. Um,
Right. It's good to have a very wide sense of yeah.
what is her diet consist of?
That is mainly tropical, more of carbohydrate, a little bit of protein, and some vegetables.
And how many members are in the family?
How many members are in the family? Okay, let me ask her. Who know any idea? 12.
12 members in the family. Is she eating 2 to 3 meals a day? Like what is her portion size?
Well, her portion size is okay to feed her. So she eats about 4 times a day.
4 times a day. Okay, that's good. So primarily, moving on to like the specific diagnosis aspect, I'd like to ask for a malaria rapid blood test. Along with that, I'd also like to run a complete blood count.
Okay, perfect. So a complete blood count is negative. However, her test is positive for malaria.
Malaria, and is it okay? So malaria. Um, since there's no symptoms such as like prostration, there's nothing like coma or seizures or severe. abdominal pain, I'm going to go with that it's mild malaria or uncomplicated malaria. So since it is uncomplicated malaria as
Perfect.
confirmed,
Yeah, yeah, yeah. You're speaking like a doctor. All
since
right,
it's
that's perfect. Yeah.
since it's uncomplicated malaria as confirmed by the test, and since she has some pain, I recommend rehydration. I also recommend taking any antipyretics for fever. For that's for fever. Along with that, some antibiotics such as ACT.
Yeah.
Um,
Perfect.
and for prevention specifically, for malaria, what I recommend is having full clothing on the entire time. Along with that, having mosquito repellent and bug spray in the house. And finally, having mosquito nets placed all throughout the house such that the mosquitoes can't get in. And finally, staying away from still water, which are commonly known as mosquito breeding grounds.
That's excellent. You've done wonderfully well.
Okay, thank you so much. Have a great day.
Is it permitted for you to clap for yourself? I would have said you should give yourself a round of applause.
I'll clap for
All
myself.
right, all right, all right. So thank you very much for diagnosing my patient today.
Okay, thank you so much. Have a great day.
All right, you too. Bye.
Bye.